Excellent. So welcome all again for our third series. Thank you all that have joined us for the last three. I hope you've enjoyed it. We've got some brilliant content for you today. If we could just put some reminders, if people could switch their cameras off, that'd be great. And please use the chat. We are reading it and we will try and answer questions as we go along, and then we do produce it at the end. We are recording and it is going out afterwards, so switch your cameras off definitely if you're not happy with that. And then basically I'm going to hand over to our speakers today. So Emma, over to you.
Hello everyone. I hope you can hear me okay. This is a new thing for me, hosting a webinar. Adrian is with me around and about. We're hosting from home. We have 3 little ones in the background, so he may be vanishing to kind of look after them. First of all, I wanted to welcome everybody. I'm looking at some familiar names. It's lovely to be here on the call, on the webinar with you. Sorry not to be with you in person, but this is definitely a good alternative. Thanks to Dan, Helen and Sarah from the WMAHSN for putting this series together at quite short notice. The first 2 sessions have been absolutely brilliant, so we've got a good precedent to live up to today, and it's a real privilege to be part of them. The first webinar, we heard a bit about the power of narrative and the power of storytelling and the importance of reframing, and I'm going to start with a little bit of that in a minute. And then last week we heard about how people have been using AI to inspire in challenging times, not just the clarifying time that we're in now, but Caroline and shared some previous examples as well. And so I hope you've all learned something. Every time I hear our friends speak, I learn something new. So hopefully we all will today together as well. So next slide, please, Dan. So I was just going to start with my COVID story, I suppose. So you can see a picture of Birmingham Women's Hospital there in the sunshine. So I work mostly at the Women's Hospital, but I'm also employed by QE, which you can just see in the corner of the photo there. And the QE has the biggest intensive care unit in Europe. And so as you can imagine, when the pandemic kind of began, the degree of kind of planning and preparation that went on was quite extensive, and we didn't quite know what would be expected of us. But as an anaesthetist, I felt that I might be needed to go and work on intensive care, as many of my other anaesthetic colleagues were. But as it turned out, actually, it was agreed that we, as the consultant obstetric anaesthetist, would stay at the Women's Hospital. So as many of our trainees have moved to the QE, we took over doing resident night shifts and providing the obstetric cover. And I think Alison spoke a little bit about sort of different levels of guilt that people have had for not being involved on the true front line. And I can recognise that, actually, even as an anaesthetist, even kind of working in some ways on the front line. It wasn't, you know, I wasn't there with my anaesthetic colleagues on intensive care kind of in PPE all day, although I've worn my fair share of it. So there has been, you know, there's a little bit of kind of guilt there. But then equally reframing, actually, my strengths are probably being on delivery suite and managing the women there who and the staff who were undoubtedly scared in this difficult time. So perhaps I should reframe that. Actually, I've been really fortunate to be able to kind of use my strengths in that way. There's a picture of me there smiling in one of our obstetric theatres at the Women's Hospital. It's fair to say, you know, it's not been easy. We've had, you know, the ever-changing list of policies and procedures, working out kind of how we're going to do things differently and safely. We've had some real tragedies at the Women's and Children's Hospital, and at the Women's in particular. We've lost two of our colleagues, a consultant neonatologist and one of our lovely midwives, and that hasn't, as you can imagine, been easy. there have also been some amazing moments. Kind of when we started the pandemic planning, I remember being in the room with my consultant colleagues, and I've never felt more cohesive as a group. And I think everyone has really pulled together. You know, when something needed to be done, people have just said, yes, I'll do it. Yes, I'll cover that shift. It's just been amazing to see everybody kind of work together in that way. And I think that the whole sort of teamwork is a real kind of positive that's come out of this. It's not been easy necessarily at home, but like many people, I think I've been enjoying more family time. And whilst I'm definitely not a teacher, I'm getting the hang a little bit of supporting the homeschooling. Thankfully, our daughters are excellent at it. Our son just needs a little bit more direction. But the juggling has taken on a kind of new pattern. Next slide, please, Dan. So we were sent this. Actually, our CEO at the QE Hospital has sent us many emails. I think the communication has been really excellent, actually, at the QE. And this came into my inbox last week, and it just really resonated with me. So I'm normally quite a productive person. I think it's kind of fair to say that. But actually, I found it harder to concentrate on things. I just found the kind of uncertainty really difficult to manage at times. And I got this email, and then I just thought, oh yes, this is what I'm experiencing. And I just wondered if people on the chat would be willing to share kind of how they're feeling at the moment. We were chatting in the kind of rehearsal, was it Monday, that with Helen and Dan, and Adrian was remarking on the same thing, how exhausted he's been feeling. I think it's something that many people are feeling. So if people would be willing to kind of chat in with how they're feeling, if it's easier for you, if it helps, then you can use a scale. So I think last week we used a 1 to 5 scale. So 5 would be full of energy, ready to go. And then 1 would be just feeling exhausted and needing some rest. So if people are willing to do that, then that would be great. We just get a sense of how people are feeling generally. But the important thing at the bottom there on the slide is this is just a normal way of feeling, and I really sort of needed to hear that last week. Next slide, please, Dan. So I've been thinking. I found this on Twitter, actually. I don't know who to credit it to. But I found it quite early on in the pandemic, and I found it really useful, actually, to help me to notice behaviours in myself. And I'm smiling because in the learning zone it says I stop compulsively consuming what hurts me. And I was chatting to another friend of mine, and we were remarking on how much Biscoff spread we were eating between the two of us. So I tried to do that a little bit less, but also it's helped me to kind of appreciate where other people's behaviours might have come from. So I think there's been a lot of fear generally in staff, particularly I've recognised that, you know, with the confusion over what PPE to wear. And then some of the behaviours that I kind of want to do more of, you know, there are things that I do try and do, you know, obviously thanking and appreciating people, trying to be good at adapting to changes, thinking about living in the present and not worrying about what we can't control. So I found this slide quite, this image quite useful to kind of help reinforce helpful behaviours. I was about to click on to advance the slide. Next slide, please, Dan. So one of my other roles in this pandemic has been as part of our wellbeing group. So I lead our wellbeing team in anaesthetics at the QE, which you can imagine when sort of faced with a pandemic is a kind of could be kind of overwhelming, but there's a group of us who are involved in this, so obviously that makes it easier. But this word cloud, we sent out wellbeing surveys. We're on our second one now. I'm just about to look at that, and we asked people what one thing helps their wellbeing in this time, because we wanted to get people thinking about what is good for their well-being and perhaps what they might want to do more of. And obviously you can see family came out top, but people are doing lots of exercise and also just talking to each other, telling those stories about our days, talking to our family, our friends, our colleagues, connecting in different ways. I really like what Alison said. I think it was the whole physical distancing, but socially connecting more. And we've had some family Zoom meetings meetings to kind of connect in kind of different ways. So next slide, please, Dan. So, and move on again. Yes, that's it. That's it. Thank you. So obviously, as part of this wellbeing role, I was really interested at. We talk a lot about post-traumatic stress, but then I'd heard previously about post-traumatic growth, and actually I heard it when I read this book called The Happiness Advantage by Sean Aker, and he talks about this concept of post-traumatic growth, and the sorts of things that might help people to grow after an episode of trauma. So this is what part of what Jan's going to talk to us about today, and I'm really excited to hear what he's going to say. But there's a couple of things I wanted to mention first, if you just move on, Dan. I think the first thing to say is that this is in the context of the fact that when we talk about post-traumatic growth, we're not trying to say that trauma is okay. Clearly, the difficult situations that we've been facing, it doesn't mean that that's a good thing that that's happened. It's just trying to find a way to move forward in a positive way. So, you know, it is the kind of grey clouds with a silver lining. It is the you know, what can we learn? How can we grow through this experience? But you know, in many ways, would rather this wasn't having to happen. I don't think it's necessarily exclusive, mutually exclusive. It's not like either or, like you have distress so you can't grow. I think you can have both. But what's really interesting, and what hopefully we're going to think about a little bit today, is what makes it more likely. What are those factors that mean that we can grow and move forward, and use appreciative inquiry to help us with that. So next slide, please. So I've probably talked for long enough. I'm going to hand over to Jan in a minute. So I met Jan at the World Appreciative Inquiry conference in Nice last year. It was lovely and sunny. And Jan is an international appreciative inquiry practitioner. He's also a poet, and he wrote a poem, maybe I'll share that later, about his experiences of at the World Appreciative Inquiry conference. And he's going to talk to us about focus and about an appreciative and a growth mindset. So I'll hand over to Jan now. Oh, sorry, just before I do, Helen, is there anything from the chat that I'm wanting to pick up on, actually? Sorry.
Hey, you're fine. Actually, people have been really honest and sharing. There's lots of 3s and 4s, but the main word that I keep seeing is uncertainty, how people are really struggling with that.
Yeah, it's hard, isn't it? Yeah, I completely kind of recognise that, you know, just not quite knowing what's coming next. So, well, hopefully, I'm sure we'll hear some useful tips from Jan about what the sorts of things we can do to help us. Over to you, Jan.
Okay, thank you very much. Thank you very much. Good afternoon, everybody. I'm Jan Sommers, and I'm calling to you from Belgium. I'm very honored to be asked as a keynote speaker here on this webinar, both the keynote speaker and the participant. I'm not a native English speaking person. I speak Flemish and Dutch, but so bear with me, and I will do my best to give you hopefully an inspirational content and sharing. Well-being is a matter that is close to my heart. My wife works here in Belgium in a care home for elderly people, so we've been faced with the corona crisis on different levels. Okay, so next slide, please, Daniel. The link with me to the United Kingdom, I owe a great deal to the United Kingdom, because my career actually started working for your Ministry of Defence as a locally employed Belgian civilian. I worked for your MOD in Belgium, UK, and Germany, and I was trained as a work-study practitioner at the Royal Military College of Science in Shrivenham near Swindon, at the Cranfield Institute of Technology, and in Appreciative Inquiry, people very often refer to words create worlds. Now, the opening speech of the then rector, Professor Tom Cass, made a world of difference for me. And what he said at the opening speech is, when you will be working with organizations, you will apply about 15% techniques that you learned here at school. 15% you will be using your common sense, but 70% will be matters of human interaction. So get interested in how humans function, because you will need it. Now, that speech triggered in me the ever ongoing learning path in how the dynamics of people are. So in 1991, I started, after a career with the British Forces as a Belgian civilian, I started in 1991 to become a self-employed coach, facilitator, consultant, which I'm still doing right now. So next slide, please, Daniel. How I got in touch and was touched by Appreciative Inquiry in one single drawing and one question goes back to 2009. And you see on the screen, you see this drawing underneath the text. And that was at a brief introductory workshop in Leuven in Belgium. And the facilitator of that workshop, he made this drawing and he asked us one question. And the question was, what do you think of my circle? Now you can guess what the answers were. Sort of like, this is not a circle, this is not complete, this is not round, this is more looking like an egg in construction. Because what happened? We were focusing on the gap. So if you give the next slide, please, Daniel. The next slide makes it a bit clearer. The appreciative inquiry versus gap thinking. Now, if we get the question, what do you think of my circle? And we start looking at the what is not the circle, then we are looking at the gap. And so we can either look at the gap or we can look at the green line, what was there. Now, okay, he did not draw a circle. He didn't draw a circle. That's correct. But what is, if we were to focus on the green line, that is focusing on the potential, which goes more and far more beyond the circle. In fact, what he did there by making this curve with a loose hand, just like that, that movement may well have the potential to create some art, to become whatever Picasso for the next generation. There is much more potential there if you focus on the green line, as opposed to if you look at the gap. So for me, it was immediately sort of like triggered, it became clear, like appreciative inquiry is giving you the possibility to look at what is. Not saying that it's a circle, because it isn't, but looking at what is and what is the potential that you want to achieve. Now, one of these examples, how this drawing made a difference is after I went to Nepal to the World Appreciative Inquiry conference in 2009. I was running a coaching workshop with different sessions, and at the first session, I asked the people who were the participants, I asked them, how is the weather inside? How is the weather inside your head? And people started sharing, like somebody said, oh, it's quite sunny. Somebody said, yeah, it's a bit cloudy. And there was this woman who said, well, if I'm honest, the weather inside of me, it's dark, it's thunder, it's lightning. I'm in a heavy storm. And I'll explain why, because I'm going to get questions anyway. So she explained why the weather was so bad for her. She said, I'm a single mom, and I have a son of 18 years old. Last year, we had so many conflicts and quarrels about what he did not do, what he postponed, what he did wrong. And last week, we had the severest clash, and he left the house with the message, you won't see me back in your lifetime. I'm out. So she says, I've lost my son. I've tried to reach him because I'm dead worried. I lost my son. And now I'm stuck on a course of coaching. So that was quite heavy for me. And I said, well, the only thing I can think of at the moment is looking at this circle or this drawing. So I drew this drawing on the paper. And I said, well, you have perhaps an option is if you are a mother of an 18-year-old son, during those 18 years, undoubtedly you will have had many, many moments that you are extremely proud, that you had extreme fun with your son. Maybe you can list them. What were those moments of proudness? What were those moments of joy that you had with your son over the last 18 years? And maybe you can start WhatsApping or texting that to your son. I don't know, but it's a possible way. And at the next moment when I saw her many weeks afterwards, I asked the participants at the end of the session. I asked them what they got out of the session, and this woman said, "Well, what I got out of the session, I got my son back. You gave me my son back." I said, "I didn't give anything. I only asked you to perhaps look at this in this way." She said, "Well, that's exactly what I did. I made a list of moments where I was proud and joyful with my son, and I started sending that to my son's mobile number. And he reconnected. He said, maybe we should have a coffee. So they restored their contact. So that's a very practical example of how this circle is actually can be vital in how do we look at a situation. If you get children coming home with points, with the scores from the school, where do you look at? Do you look at the progression? Do you look at the successes they made in the past and then help use that for building on that? Or are you just looking at the bad scores, for instance? Yeah. So that is how this circle got me in touch and touched me with appreciative inquiry. Next slide, please. Yes. Now, if I look at the dictionary about what is the wording of appreciative inquiry, there's two words, two definitions that stick out that for me are very important with regards to appreciative inquiry, and that is, on the one hand, appreciating is to raise value, and inquiring is the action of asking. Now, so you could ask yourself, what is it that you wish to grow in value, that you want to come alive again or more in your life, in your job, in your relationship, in your organization? What is it that you want to come alive? Because if you start then in the action of asking generative questions, it helps to raise value for it to grow, right? At a very personal level, but also at other domains as well. Okay, so next slide, please. Now, where do you put your focus? What if you were from a motorcyclist? Because as is for motorcycling, appreciative inquiry has a lot to do with your focus skills. I don't know if anybody is around who is a motorcyclist, but one of the most important skills of motorcyclists is the way they look, the way they watch in the direction where you are headed. Because if you focus on the trees next to the road, that's probably either you end up next to the trees, or you will end up at the wrong lane of the street with all the risks involved. So it's crucial to look at where you want to head for. Like when you want to go on, for instance, you want to take yourself and your children to, for instance, the south of France, you hold that picture of the south of France, of your dream destination in your mind, because that will give you the energy to make the journey, to overcome the traffic jams, because it's that dream picture, where am I heading, that is helping you. So it's important, both from the drawing that I showed you just now and the motorcyclist, is to have your focus right. Next slide, please, Daniel. Right. Okay. So I did see some scores on how you are all feeling, and one of the things I do quite often in Belgium is do workshops on working with a healthy enthusiasm. So I do meet a lot of people who are either facing the border of the burnout stadium or have been in a burnout stadium. And usually we use 4 types of criteria to say when somebody's ending up in the burnout stadium. And that is, one is on the energy level. Is that okay, or are you facing exhaustion? The second one is, are you still mentally committed in what you are doing, or are you keeping a distance, mentally distance, like I can't be bothered anymore? The third one is the cognitive system. Is that okay? Is your thinking and your concentration capacity still okay, or is it becoming disordered? And the fourth one is the emotional in control, or are you there also facing disorders? So being in emotionally control is also one of these criteria. I usually use the metaphor of the horse riding for talking to people on my workshops. And the metaphor goes like this, that the driver on the horse is representing the mind, and the body is the horse, right? Your body is represented by the horse, and your mind is represented by the driver of the horse. Now, what happens with a burnout is, what I hear a lot people testimonying is they're saying, I wanted still to continue, but all of a sudden, that very morning, I could not get, with the best of will, I could not get out of my bed anymore. I could not prepare the sandwiches for my children anymore. So it was like the disconnection between the mind and the body. And all the people that I meet always say, if only I took notice of the signals or the symptoms of my body to tell me I have to work on my reconnection, I could have prevented me from going in a deep in a deep hole. So it is very important to keep track of that. Now, I want to, because on the first session of this webinar series, there was a reference made to a glass which was half full with water, and then the question was, is it half full or is it half empty? I have here a glass. I use it in a different way, and I don't know if you can see the glass, but right, this is a glass with a bit of water. What I usually ask is, how much does this glass weigh? And people say, well, not a lot. It's probably not so heavy. Now, okay, what I then ask is, what would happen if I were to ask you to stretch your arm and hold it for about an hour? Right? So if I was to say, hold this for an hour, would this glass still be lightweighted? It's probably going to hurt, right? So what I want to say is, the water inside the glass is the emotional burden that you are facing. So you need a safe base from time to time to empty your glass. Because if you keep holding on to that and keep holding to your glass and saying, I have to be courageous, then you probably end up with some backfiring or trouble. How do you say that in English, right? So that's how I use the metaphor of the glass as well, to make sure that you empty the glass in time. Yes. Okay, so next slide, please. Right. So one of the things that I often see, or what I often hear, and also I have been hearing in this webinar series, is of this feeling of guilt, of not being able to switch off, difficulty in facing the tasks at home and still thinking of the tasks at work. Maybe the message that I want to bring here is that the main message is it's okay. It's okay to switch off when you are moving in either the direction of your work or the direction of your house, right? When it's okay. You don't have to feel guilty when you are at home having fun with your children or with your partner or relaxing or whatever. It's okay, right? And it's also okay to switch off when you're at work, not to sort of keep on thinking and doing lots of things on your private thing. It's okay to feel sad, but not to have it control you. But it's okay to feel sad. It's okay to feel sometimes frustrated. It's okay. It's okay to cry from time to time. It's okay to be a human with emotions. And it's okay to take on a personal growth challenge, to understand these emotions in order not to control your life. You are not your behaviors, you do your behaviors. Right? And as I was referring to focus, where do you put your focus? Focus is an important way to, shall we say, between quotes, like relaxing your mental muscle, so to speak. So I have two questions for you to think about for a moment, and perhaps you can, if you want, enter your reaction or your answer on the two questions in the chat box. The first question is, what are your rituals to manage your focus? What rituals are you using to manage your own focus? And the second one is, how can you contribute to the capacity of others to focus? Because when you are focused, the best of yourself comes up, and all other matters that are on the side sort of like are a bit muted. So it's very powerful and very good for your resilience to be able to focus. So what are your own rituals? And how can you contribute to the capacity of others to focus? So two questions. So if you can just answer, if you want, share some of your answers in the chat box. We'll have a talk about in a moment on that. In the meanwhile, whilst you're thinking and answering, I will want to go through sort of like different types of focus. One focus is the focus on self-worth, the unconditional self-worth focus. Not questioning, am I good enough? Yes, you are good because you're a human being, you are good, right? So it's unconditional. The second focus is the focus on your own locus of control. What can I do? Not focusing on what do other people do wrong, but what can I do? What is my locus of control? A third type of focus you can use is focus on success experiences and finding pearls in your routine. I have discovered, just to give you an example, I have discovered that when I wake up every morning, I do the dishes of the pieces that are not going in the dishwasher. I use that to find a routine which for me is very relaxing. So for me, that's like a Zen moment. And my wife is happy because the dishes are done. Focus on bringing clarity. It's another type of focus. Focus on bringing clarity. Clarity of what do you mean? What do I need? What I want to say. Focusing on that, on bringing the clarity. Focusing on team-oriented tackling of challenges. Don't try to conquer the world on your own. Try to make it a team-oriented tackling of challenges. That helps. Also, another focus is focusing on reframing, reformulating to conversations worth having. Yes, there is some great books, and I guess that you probably get some links on that on the interesting book that is written on conversation worth having. Also, the other one is focusing on your internal drives, focusing on your calling, so to speak. So focus on value-driven behavior, right? Instead of desire-driven behavior, such as desire for appreciation, desire for attention, and all that. You can focus on values-driven behavior, so that you can have more control of that as well. Okay, so let's find out, Helen. What have you noticed in the chat whilst I was doing my talking?
Again, people have been so honest and open, and some beautiful messages on there. Jan, you'll have to have a look later, but some of the things I've wrote down, a lot of the common words is meditation, breathing exercises, active listening, be clear on the working day when that ends, focusing on things you can control. Tim talks about 3 good things and journaling. Someone put binging on box sets. So
again, what was the last one?
Binging on a box set, which I, yes, applaud, support that fully.
I think it is about, like people have mentioned all those things that they've recognised they need to do for themselves to sort of feel okay, and allowing themselves time to do that, which I think is really, really important, and actually to build that in as part of your sort of daily practice. I think the control thing came up a few times, which really resonates with me. You know, we can worry about all this stuff, but what can we do anything about it? I think they teach my kids at school, do you have a problem? Yes, no. Can you do something about it? Yes, then do it. No, then don't worry. And that sort of, you know, that I think is really important. I really like the comment. There was something about the sort of coaching and helping others to reframe as well. You know, what would you want to have happen? So to try and redirect people to kind of think of the possibilities rather than be constrained by the problems. I think that's kind of a really useful tool and technique. Lots of stuff about being outside in nature, gardening. There was someone who said it was painting, gardening, exercise, but not all together.
Yeah. It's very what works is individual. Is like what works for you doesn't perhaps work for me, but it's finding out what does work for me. And on one specific note on helping others to focus, what I do notice when I get into organizations, companies, sometimes is that people, like for instance, you're, and that was before the pandemic, people that were sort of like facing somebody seriously ill at home, for instance, your mother or your father very ill at home, and then you get to work and somebody on the parking spot sees you coming out of your car, comes to you and asks you, how is your mother doing? And so you start talking about how your mother is doing. And then you go into the building and the first colleague that you see asks the same question, how's your mother doing? And so it goes on like that. And you meet other contacts in the workplace and they all keep asking, how's your mother and how are you coping? And so sometimes in that way, you keep people in that focus of misery. And sometimes you have to let loose, and to have to allow the person to relax by focusing on the job, or vice versa, right? So when you come at home, when your partner starts asking questions about your job and what happened, and sometimes people need to be able to switch off. But yeah, great. I look forward to reading on the chat box after the webinar what has been said. Okay, so maybe we can continue by the next slides. Yes, right. There has always been a close link between appreciative inquiry in relation to positive psychology and also post-traumatic growth, as Emma was referring to. So Professor Seligman, who has done some groundbreaking investigations and research on the positive psychology, one of his famous quote is, "Well-being is not the absence of misery." What he found out is that people in the therapeutic settings and psychiatrists and all that were trained to look into disorders, to look into why is he not functioning and how can we remedy, how can we find a, yeah, is it English? Yeah, remedy, a remedy for that person recovering from feeling bad. But that doesn't mean that if the misery is absent, that you are in a state of well-being. I'll talk about that in a moment, what scheme is that Professor Seligman proposes for that. The other aspect is, what he discovered is when people were facing very traumatic times, like for instance going to war zone or other types of traumatic experiences, is that he discovered that there is some sort of Gauss curve where there is a distribution between people that are developing post-traumatic stress disorders. But there was also, on the other side of the curve, people that are developing post-traumatic growth. Now, for me, my wife, and that's on a very personal note, but for me, my wife is the living example of post-traumatic growth. She was diagnosed at a quite young age on some disorder, I think the disease of Hashimoto or something in the thyroids. Is that the correct English word, in the throat? And then back in 2007, she was diagnosed with rheumatoid arthritis. And in 2008, she was diagnosed with breast cancer. And what it did to her, and in the last phase when the diagnosis of the breast cancer came, for her, it was like, this is a moment of, I can choose to either undergo all this and feel sad and feel bad. And she was feeling bad. But at the same time, she took with both hands all the positive things that came onto her path. She closed the door for people that were negative, bringing negative messages, or not messages, like negative stories. She immediately after, at the moment she recovered more or less, she signed up to climb the Monte Perdido mountain in Spain with a group of cancer patients. She changed this, her outlook on life has changed by that for the better. She says, I didn't, if I ask her now, when sort of, if I ask her now, are you happy that you had the cancer? Of course not. Of course she didn't, she's not happy having had the cancer. But it brought her such a richness, it brought her such powerful insights that she's now living as a different person. So for me, she is a living example of post-traumatic growth. And since well-being is a matter that is close to my heart as well, if we look into what are then the facilitating steps for to increase the chances of post-traumatic growth, is one first element I want to say is make sure that you restore your vagus nerve system, right? Professor Porges and Martin Rosenberg have done some excellent work on that, and there's some great ways to make sure that your craniosacral system, which keeps you either in a fight, flight, or freeze modus, is relaxed by doing some breathing exercises and other exercises. There's some great stuff available for that. So the second one is gaining insight in the post-traumatic growth potentiality. To look at, okay, there is a potential. There is a potential for me coming out of this traumatic experience in a very positive, stronger way as before. And when you look at the stories of this post-traumatic growth, that can inspire you to say, okay, maybe that is my light at the end of my tunnel. A third aspect that I want to touch on is learning to handle emotions, to learning to understand why is the emotion happening to me, and how is this taking control over my emotions, and to be able to handle that. The fourth element of post-traumatic growth is going through the exercise of surfacing your assumptions that you are using that steer your way of life and your way of doing. So it's what are my assumptions that are steering me, and challenge those assumptions, right? The next one is the writing of your new alternative narrative. What I mean with that is people tend to, if you ask people for the story of their life, they tend to choose a number of moments in their life which they connect the dots, and the connecting the dots is becoming their story of their life. Then if that's the case, it's very important which dots in your life, which moments are you choosing. And so what I usually do is try to help people to write their alternative narrative, the narrative of what is your best version that you have experienced, and how can we ensure that that becomes the story of your life and the story of your future, rather than trying to find the bad spots in your life and saying, this is my narrative. And last but not least is what helps is to embrace life-giving principles. What are principles in your life that gives you energy, that gives you well-being? And that is an exercise, or those steps are usually quite helpful to increase the chance of going through a post-traumatic growth. But as Emma was quite rightly saying, it can happen both. I mean, you can be feeling very bad, as I was explaining with my wife, can feel very bad, but in the same time, simultaneously, you can start working slowly, step by step, onto moving up the hill of the post-traumatic growth. Yes. Okay, so in the next slide, I just want to refer back to Professor Seligman on the positive psychology. Very interesting to read afterwards, but these are the elements that Professor Seligman says constitute well-being, and it's the PERMI abbreviation. So we talk about positive emotions, being able to engage for flow experiences in what you do, have relationships that are mainly good or positive, feeling that you are doing meaningful job and understanding the meaningfulness of your job and the purpose, being able to achieve results and accomplishments if that is made possible. And then there is this invisible hand, these contextual elements that facilitate. There is some very interesting stuff on the net if you want. If you type in Professor Martin Seligman, he's very inspirational on those matters. Yes, next slide, please. One of the exercises is you can do is when Emma was asking you, in what state are you feeling at the moment, between 0 to 5, or you can use 1 to 10, whatever. One of the scale exercises that I do a lot, in which appreciative inquiry comes in handy as well, is I ask people to put themselves on a scale, like for instance, whatever topic you are covering, like for instance, level of energy or level of commitment or that kind of things. And then I ask them, right, where would you score yourself? It's important to have the score in your head correct. If you express it to others, that's another thing. But at least you have to have it in your head. So what is the score? Now, say that you give yourself, for instance, 4 out of 10. Now, there is different ways to look at this. One question you can ask yourself is, what makes me stand at a score of 4? How does this score of 4 manifest itself for me to choose 4? To be fully aware of why am I choosing this score? And then you can look back from the 4 to the 1. You turn to the 1 and you say, okay, how did I manage to get myself or keep myself at 4? Maybe in a couple of months ago you were at 2 and now you have reached level 4. I've had at some occasions somebody was standing at 1. And that was a session on working with enthusiasm, with healthy enthusiasm. And she put herself on 1. So I asked her the question, you are on 1. What has helped you to be on 1 and not on 0? And she said, yeah, that was on a Monday morning. She said, yeah, Friday I went to for an urgent consultation with a person that is more like a therapist, and we had a very good conversation, and that helped me to manage to get up today and to be here. That kept her on 1, or that got her on 1. Okay, so that's very powerful, knowing where you are, what helped to keep you there or to get you there. And then you look at the 10. But when you look at the 10, it's not about how do I get to the 10, but it's interesting to discover what you think of the 10, but then what is the small step that I can take tomorrow which brings me to 5? As opposed to, how can I get tomorrow to 10? No, how can I get to 5? And the next one will be, how do I get to 6? And what can I do to make sure that I don't drop back to a lower score? So that is one possible exercise to use on yourself or with others. What am I doing at the moment? Where is my score? Why is this my score? What have I done to get myself here or to keep myself here? And what is my next +1 to get me towards my state, my dream state? Okay, so 2 more things I would like to go through in a moment. So next slide, please, Dan. Right. Okay. Now, as Emma was quite rightly describing from her own experience, and which I've heard very often, is that there is some positive team building and cohesion effects of this COVID-19 crisis. Yeah? And the question for organizations is the question, how can we make sure that this lives on for after the lockdown period, after the crisis period? How can we sustain this level of collaboration, cohesion, and team building? And what I think is that the questions which I put down there are a very good start. Like, what is the challenge normal, and which behavioral practices were being challenged? So there's some interesting questions, like question 3, how would you call this positive emergence of manifestation? This cohesion, this team building effect, what name would you give to it? And I give you an example. One of my customers is, one of my clients is Mazda Corporation. Now Mazda, if you talk to people in Mazda and you talk about Mukainada, Mukainada, it will ring a bell, because what is Mukainada? It's the name of the Mukainada spirit, and the Mukainada spirit refers to the village Mukainada, which is close to Hiroshima, where when the bombing in the old days fell on Hiroshima, everything was devastated. And it's in Mukainada that Mazda Corporation restored themselves and rebuilt themselves, and it was this cohesion at the Mazda Corporation workers at the time that they've given the name Mukainada spirit. In fact, this morning I got an email from an HR manager from one of the Mazda divisions, and at the end of the email she writes, with Mukainada greetings. For me, that resonates a lot. So those questions, I would say, if you are a manager or a leader of an organization, these questions are a good start to go. Now, let me just finish with a metaphor and a little poem. You can see here on the picture, there is a door from a room that goes open. Which way goes the light? Which way goes the darkness? What happens to the darkness? So I wrote this little poem. When someone is in a dark room and somebody opens a door from a room full of light, the dark room will lighten up and not the other way around. So let us all open a door of a dark room, shedding light on the beauty and the strengths of the person inside. I wish you all the light of love. Thank you for your attention, and I would like to give back the word to Emma.
Thank you. Yeah, I'm just turning on my webcam again. That was really lovely, and actually you're going to love it when you see the chat. There was a comment earlier on about the quote from Dumbledore about the darkness. It just sort of, the chat has kind of mirrored what you've been saying really, really beautifully, actually. And there's been some chat about the kind of that technique you talked about, kind of saying where you are on a scale and then how you move kind of up a point. And I forgot who it was, but somebody had said about, you know, want to get right the way to 10 straight away, but it's not about that. It's not about doing everything at once. It's just about those small incremental things we can do to kind of grow every day, really, isn't it? Just wondering if anybody has any specific questions. And I know we haven't got lots of time, but we have got time for a couple. And if people want to turn on their webcam and ask a question, then they're very welcome to do that. No one's too shy. I think we all have examples of times in our life that have been difficult, don't we? And I read an article by Sean Aker, actually. He was talking about kind of think about the times when you've grown most in your life, and actually they'll nearly always be associated with a time of stress or difficulty, whether it's a new job or a new child or a period of illness. And many of you will have heard Adrian or myself speak about learning from excellence, and I think that whole concept of noticing the good came out of a period which was certainly challenging for us. So there's definite, you know, truth there. It takes time, but it's really important to try and use that time to reflect and pick out the sort of what you want to do in the future.
Yeah, that I hope that the message from the appreciative inquiry sometimes get confused with looking into the positive and looking into the naive sort of like pink sunglasses on and looking at everything is beautiful and nice. No, it's looking at the reality and inquiring into the reality in a generative way, in a way that gives life and that gives you energy and gives you possibilities. So I always use the metaphor of like, if you have a garbage bag and in this sunny, well, I mean, in Belgium, it's still sunny. I know that it's a bit raining in UK, I guess. But if you have a garbage bag and the garbage bag is stinking, now, what do? Well, you take the garbage bag, you close it and you put it outside so that the smell doesn't hinder you a lot. Now, if I was to say, in the old sort of like psychological way of thinking, we could say, okay, let's analyze to the bottom of your garbage bag why your garbage bag is stinking. Now, everything will start stinking. Right? So it's good to inquire yourself, what happened that made this bag probably stink? And let's do it better for the next garbage bag to fill without a smell. But anyway, I talk too much. I talk too much.
Oh no, yeah, it's lovely. It's lovely to hear you talk. And people are saying, you know, they how much they've loved it and they love the metaphors. I think it all helps us to understand things better. There's some reflections on the chat about it was a cloudy day, but the sun is out now. I think that's kind of a little bit how I feel the weather in my head is a little bit at the moment. So that's really, really lovely. And I think we're going to have to kind of wrap it up there, but just I wanted to say that what I'm going to try and do is think about the things that I can do to help myself focus in a more positive way, and I'd encourage others to do the same, and also to think about how you can kind of spread that to others and help them to focus. And I've picked up some amazing tips from the chat there, which will be sent out to us all, so we'll be able to have a kind of record of that and reflect on that.
Wow.
Helen, is there anything else? I mean, massive thank you, Jan, for those slides and the stories. I mean, I love that story about that woman and her son, kind of spellbinding, really. So, you know, it's fantastic.
Yeah,
So thank you very much.
Okay, you're welcome.
Huge thank you. And just for everyone, there'll be the session next week as a roundup. Hope you can all join us. And Jan, yes, I could just hear you talk for another hour. So thank you all, and hopefully we'll see you all tune in next week.
Will do. Thank you, everybody.
Sarah, do you want to stop recording?